In this video, I wanted to talk about my journey in building my virtual medical practice. I've always worked for an employer, and at some point I decided that I wanted to have my own patients. I wanted to practice medicine in my own style. The first foray into that was to build a diabetes prevention practice. It was all virtual. It was online. I started a website for it. I started writing some stuff on social media. At the time, I didn't have any presence on social media, so it was really difficult for me to gain any traction. And of course, I didn't know really what to put on social media that would be captivating. And I didn't really have a long-term plan, like how much content was I going to put out? What was I selling to the patient? There wasn't a clear message. Over time, I refined it a little bit, and I got a few people who were interested. It was people who were diagnosed with prediabetes. Even though I didn't even think to focus on people with prediabetes, my goal was to talk about complete diabetes prevention from a very healthy person, given the fact that it's prevalent. Later, I dabbled with people who already had diabetes and trying to help them reverse it. One thing I learned is that the kind of patients that gravitated towards my practice were people who were the idea of having diabetes was very ingrained in their lifestyle, meaning it was really impossible, for me it felt impossible to get individuals like this to turn their lifestyle around. And I wasn't interested at the time in any kind of coaching, lifestyle coaching, to get them to change how they were behaving, what they were eating, what they were doing. And I didn't find them to be very interested in that either. So some frustration grew in my practice because I'm like, well, the people who are coming to me are not the kind of people I'm interested in. The people who are not coming to me are doing it themselves. So I decided to scrap the entire idea. I didn't run any advertisements. I didn't do any more social media marketing. And of course, I said, all right, I went to this arena of diabetes, chronic disease, complete prevention, and that didn't sit well with me. I didn't like it. So I said, let me go towards people who are already healthy. So I decided to start a practice called, it was climbing coach or climbing something. And it was focused on rock climbers who are pretty healthy already, usually younger. And it was about just keeping them healthy, helping them with injuries, injury prevention. So I started posting a lot of content about rock climbing, actually. And I gained some traction, but I got no patients. I got nobody who was interested in working with me. And now looking back, I think my niche was not at all defined. Nobody really knew what was I doing, like what was I selling. Were you a sports medicine? Were you trying to be a sports medicine doctor? Were you trying to be a nutritionist? Were you trying to be like a coach, like a personal trainer? It was very unclear. Now, for background, for those of you who don't know me, I'm a family medicine doctor. So for us, especially with our broad background, it's not difficult to dabble in lifestyle medicine, functional medicine, nutrition, in exercise physiology, in sports medicine. However, at some point, somebody's going to want to know, like, what is this guy talking about? One day he's posting a rock climbing video, another day he's talking about his nutrition. So the message was unclear, and I was all over the place while I was trying to discover what I wanted to do. That was the first time I really took to Instagram to try to post a lot of content, and my content wasn't good content for sure, but it wasn't there was no message to it. There was no concept to it. If somebody looked on my page, they would say, oh, maybe this is a private personal page. So the message got lost, and really I got no conversions from social media posting. The next idea that I had was, let me just focus on primary care. So I started a practice, I don't remember the name of it now. Anyway, it was it was purely virtual, and it was all about primary care, just getting primary care patients and doing it virtually. I knew about DPC at the time, but I wasn't interested in DPC for a few reasons, and we'll get into that. So I ran that practice for a little bit. I got a couple of patients who were interested in working with me, but it was so messy in the sense that I had no real. By the way, the reason I got those patients was because I was already on Quora, I was on Reddit, I was on LinkedIn. So people found me. They started noticing, oh, here's this practice. Oh, he actually sees patients. Oh, he's in California and Alaska. And at the time, I think I also had Washington medical license. But I really had no idea how to manage these patients. I would get one patient who's a classic Medicare, really complicated patients. I would get one patient who's much healthier, younger, and they want to talk about something really niche. At the time, even maybe this is about 4 or 5 years ago, some longevity stuff, some biohacking stuff, which I wasn't into. So needless to say, it became really frustrating to run that. I started shopping around for malpractice insurance. I started without malpractice insurance in the beginning. Here in the state of California, there's no mandate to have malpractice coverage. And in those beginning stages for me running a practice, having malpractice insurance is the least likely effective way for me to mitigate risk. The most effective way is for me to really give great clinical care and attention to my patients. So I didn't have malpractice. I started shopping around for it. And back then, having a virtual only practice, there were not a lot of malpractice carriers who were willing to undertake that low risk, but they didn't want to do it. The few patients that I had, after some time, I said, hey, I'm going to transfer you. I'm going to have you go work with someone else. And I think that was good. That was good because a pure, direct primary care practice for me, especially somebody who had a lot of urgent care experience, and now suddenly transitioning into this wide field of primary care without any niche. Again, I want to really specify, even though maybe the rock climber community and the diabetes community seemed niche, it really wasn't. I had no way of properly marketing and getting my message across because nobody really understood, what is this guy doing? Is he just a family medicine doctor? Okay, how come he doesn't take my insurance? The niche that I could have focused on is cash-based, one-off visits or primary care visits. And of course, that takes me to the next one. The next one was Digital Nomad Health. In fact, if you go to Digital Nomad Health, I still have that website for a few SEO, search engine optimization reasons, but it's going to disappear soon. And Digital Nomad was great in the sense that it was the first time that I actually figured out the niche that I wanted to be in, which was patients who were expats, who were travelers, who were nomads, who probably were not going to be in one place for a long time. So their care is going to be all over the place. They need to go get surgery one place. They might need to get their medication filled in another country. And that was really fascinating to me. So it was Digital Nomad Health. I had a few offshoots of it. One was called Expat Health. So the way I started the YouTube channel for that is I just called it Expat Health. I had one-off consults. I had coaching. And again, it seemed all over the place to me. I just didn't feel like I knew how to market it. For the first time, I knew my niche, I knew what it was, but I didn't know how to market it. I didn't know how to get it to the right place. For example, a good marketing strategy would be to create maybe 3 channels of good content, whether it's a podcast and blog and a social media channel like Instagram, and get that content to start slowly gaining some traction, maybe make some modifications. Once some of that content gains traction, then you start running some advertisements on it just to get it out there. Then you collaborate with other content creators or other physicians and medical groups to try to get some referrals. For example, there was an insurance company at the time, I think they still have it, Nomad Insurance, and I could have just worked with them and said, hey, this is what I offer. And I didn't even think about it. Back then, I didn't know. This is maybe about 3 years ago now. I did have one breakthrough. I reached out to somebody with a pretty good YouTube channel, 150,000 people, which is way too big, by the way. You don't need to reach out to that big of a YouTube channel when you're first getting started. But he was really nice, and he pretty much only created content for expats, and he had me on, and we had a great YouTube live video thing, and he interviewed me, and I got a bunch of referrals from that, and a couple of consults that was helpful, a bunch of subscribers from it. But again, I don't think I really knew how to continue that momentum and how to keep getting those patients, because that's momentary, right? Even that one video that you do is momentary. You're going to have to do multiple of those videos. And of course, I was really focusing on those higher volume channels. And let's be honest, somebody with 150,000 subscribers is just not going to want to work with you when you first start. I'm not done. So anyway, that kind of slowly faded out just because I didn't have interest, and I was focusing a lot on this channel, on this brand, which is my Digital Nomad Physician brand. And so I decided that, all right, maybe the next iteration should be something less clinical, less pure medical. And even though expat was that, maybe that's what gave me the idea to focus on something less clinical, I decided to do heart health coaching. And this was completely out of nowhere. I felt really like, oh my God, I know nothing about this. Well, not that I don't know nothing about heart health. I think cardiovascular medicine has always fascinated me. I had read a lot about lipidology and kind of CHF management and those kind of things. So I didn't feel ill-prepared. If anything, I over-prepared clinically, thinking that the people who are going to come to me are going to have these really complex LPA questions and familial hyperlipidemia. And let's face it, that's not what patients are going to come to you for. So I was going down the wrong track to prepare for this kind of practice, but I was really putting a lot of effort into learning everything possible for it. I even got a functional nutrition certificate and took a whole course, like 9-month course, just so that I could like do the nutrition coaching and counseling for this heart health brand. That actually did quite well, and I charged a lot for it. I don't remember how much, but several $100s an hour. I don't remember how much, but it took off. It did take off. I wouldn't say it took off, but let's say it got good traction. If I continued with it, I think I would have liked it. However, once again, the piece that I don't think I got right is my marketing wasn't getting the right people to me. It was getting the wrong people to me. What I mean by that, most of the people who were coming to me were basically of the camp that, hey, statins are bad and my doctor wants me to be on a statin. How, do I really need a statin? Or my doctor says I need a pacemaker. Do I need to be on this pacemaker? My doctor says that I should, I did a coronary artery calcium score and I got another one and then another one. And then I'm thinking about getting the angiogram. And it was a lot of maybe worried well people or people who really just needed to go follow the advice of their cardiologist. And I didn't want to take that role. I did not want to be a cardiologist and I did not want to be a physician. This was about being a clinical advisor, giving somebody all my knowledge, sharing with them all the information that's out there and helping them decide what's right for them, but also help them change their lifestyle. But that really wasn't happening. And now I didn't give up because I think all of these things led to me being able to kind of figure out, what is it that I like? Do I like this health coaching? Do I want this clinical medicine? Do I want longitudinal care? Do I want episodic care? I just was deciding. By the way, through this whole time, I had jumped around from so many different electronic health records, just trying to test out what I really like, from med charts to acute health, acute health, AKUTE. And now I'm on Hint Health. And before that, I did the Google Docs, which actually works really well for most of the simple stuff. And I'm sure there's some other ones that I forget. So I jumped around to different things. Now, with the health coaching, I don't do any kind of charting, even though a lot of people who are not physicians who do health coaching do. I have a whole video series on that. I don't think you should practice medicine when you're doing health coaching, and most of the health coaches who are health coaches are practicing medicine in many ways. I think keeping them separate is just a fair thing for the patient, and it protects you as a physician. So finally, I did this whole big circle to come around to DPC because I had started learning about DPC and this kind of monthly subscription thing. So I decided I don't want to directly contract with someone in a DPC practice. As in, I don't know if I'm gonna like this patient. Are we gonna have that chemistry to work together long term? And what am I gonna get? Am I gonna get the pediatric patient and then all of a sudden the geriatric patient? I was really afraid of that. I decided instead to lead with healthy aging. So this is the newest iteration of my practice, and chances are it's gonna change given my history so far. I decided to start something called drashori.com. Very simple. The idea was you come to me for some general medical advice. I'm not giving you any particular specific advice, but I'm going to talk about healthy aging. Healthy aging is this space that's different from longevity. It's about, hey, I just turned 30, I'm seeing the first signs of aging. What can I do? What are some steps that I can take? I already don't buy into the hype of NAD supplements and metformin. That's not what I'm into, but I do want to stay healthy. I've seen my parents maybe develop some small chronic diseases, and I just don't want to deal with that. So I wanted to bring people in with health coaching, ask me some general questions, help them overcome some of their barriers, get them to feel like they're empowered enough to become healthy. And if they were the right people, I would invite them to be part of my DPC practice, and of course, as long as I'm licensed in their state. So think of it as a funnel of people that are coming in, that I'm doing some either one-off coaching, so they're maybe buying my services for 1 hour at $169, or they're contracting with me every month for $400 to do health coaching. And then later, if they wanted to become my patients in a DPC practice, they would just become my patients in a DPC practice. The health coaching is still separate. So the health coaching might be $400, the DPC might just be $150. And I'm very comfortable experimenting with prices and offering different people different prices. I don't think you have to offer the same price to everyone. In the insurance world, it might be different, but in your own practice, it could be what you think is right for you. And so that's what we have. This is the newest iteration of my practice. It is a combination of health coaching, which I always wanted to do. It's a combination of clinical medicine, of longitudinal care, which I always wanted to do. And as far as the marketing, well, this is the interesting part. Because I've had so much presence online now with my YouTube videos, with my podcast, with my Instagram, and even though it's a mix of everything, in the long run, people have just basically heard me talk about clinical medicine, healthcare systems, healthcare, and physician careers. So I've had physicians find me. I've had a lot of physicians wanting to be my patients. I've had a lot of people in the healthcare system wanting to be my patients. I've had random people. So that's been sort of my marketing strategy, but I don't think that's enough. In the long run, if I want to make drashori.com to be something more substantial, and I'll share those ideas in the future with you guys, I need to put in more effort to still kind of fine-tune the message. Healthy aging, what is healthy aging? How am I narrowing down that age group? How do I make sure that somebody doesn't come to me who's like, I am on all of these medications and I want to get off these medicines. Like, no, that's not what I do. That's important, right? Because I'm not a de-prescriber. If somebody wants that, they may have to work with somebody, or there might be a really good DPC doctor who does all of that. That's not me. I don't want to be that dilute. I want to focus on something. So in order to achieve that, I do have to refine my message through social media marketing, through advertisements, through the stuff that I write. So I've decided to separate the blog. I put it on Substack just to make it a little bit more professional, to make it a little bit more unique. Not focused as much on collecting the emails of people, but I do want a place for me to be able to create some online content like courses that if somebody's interested or is the right fit, I can sell that to them. I also want to continue with the coaching, and I want to be able to offer this DPC style care. So it's a lot. But I'm excited to keep dabbling in all these different things. And chances are, like out of the 5 different things that I'm interested in now, maybe 3 are going to be my main thing, and probably 1 is going to be the main income driver. We'll see. That's the experiment. I think as a physician, you have your medical license. That's the hardest thing to get. The rest of it is about experimentation. What fits well for you? There are physicians who care about being just a public face for medicine. That's fascinating. That's wonderful. They want to be the expert urologist online, but they don't want to see patients. Somebody else just wants to deal with patients. They don't want to be online. There's a different method and style for every single person. So I hope that's helpful to give you an idea of my many different medical practices and the many different iterations and versions that are likely to come. And that's the whole idea. The more you reiterate, the more you dabble, the more you test, A/B test, the more likely it is that you're going to figure out exactly that one practice that's going to be a great fit for you. So I would love to hear in the comments what you guys have tried, what you've thought about, what you've failed at. So share it in the comments below. If you have any questions, go to digitalnomadphysician.com. Take care.